Morton. How are you feeling today?
Oh, I'm okay. I'm doing all right.
Well, my name is Anne Marie. I'm your student nurse today, and I am going to be coming in and giving you your protonics. Do you know what the protonics is for?
Not really. I don't have any acid indigestion. I've heard of it before.
Well, what we do at the hospital in order to help prevent stomach upset is we use protonics, or it's also called pantoprazole, and we use that as a prophylactic to try to prevent the disease. So what I will be doing is putting it into your IV, and it will be 40 milligrams that I push into you. So I will be coming back and checking on you shortly, and we will make sure that you are all comfortable, so we'll see. Okay, so my patient has a prescription for pantoprazole, which is going to be used to help him prevent gastric ulcers, stress ulcers while he's in the hospital. He has, so I'm going to go to Pixis. I select remove meds. I'm going to find the name of Mr. Can't remember his name. I'll remember it when I see it. I'm looking for pantoprazole, and it's 40 meg. Push the button, it pops out. Now I have it, and I'm going to verify that I have pulled out a 40 meg vial. Now pantoprazole is a solid, and so all I have to do is infuse the saline in it. I've come prepared with multiple syringes and multiple wipes. So the first thing I'm going to do, I take the lid off. I am going to wipe the lid with a sterile pad. I have my needle. I'm going to twist on, pull off, and I'm just going to insert the fluid in. I wait, watch it dissolve, then I can I can either shake it, move it, but I'm waiting for it to be fully dissolved. At this point I can infuse more water, then I'm going to pull out and I will now have 10 milliliters of saline with the 40 mg of pantoprazole. I'm going to next cover the needle one more time. I'm going to label it with I can put the name of the patient. I may not want to put the name of the patient. It's going to depend on protocol. The medication, which is pantoprazole, 40 mg, and I could have the bed number, something that indicates where I'm going. You don't want to use bed numbers, so some identification. But mostly it's to remind me what I'm doing. Since I'm doing this I'm also going to take my medication bottle, because if I'm doing electronic system, I would scan the bottle, and so I need that with me, and it also helps me remind me what I'm using. So at this point, I would go to my patient. I'm going to have to put my PPE on, and I will administer. Action. All right. Knock, knock, knock. Hi, it's Anne Marie. I'm here to administer your meds now. So let me give you privacy. And what we're going to be doing is giving you that pantoprazole that I talked about, again, to help prevent stress ulcers. And I'm not going to move you. You look all comfortable. So can you tell me your name and date of birth?
Jeff Smith. My birthday is January 10th, 1989.
Sounds good. Yep, that's what I have on my orders, and that's what I have on my syringe, everything. So we are all set. Double checking everything. So what I'm doing first now is I'm looking at your IV site, double checking that there's no extravasation, which means that nothing has escaped and is going into your skin. I don't see any inflammation. Does it feel okay?
It feels okay.
Okay, great. Okay, so the first thing I'm going to do is clean the port once I find the alcohol wipe. So I'm going to clean the port with alcohol wipe. I'm going to open this up, and I could have, one of the things they recommend is to, you can always just have this open anyway, but you want to keep the lid on. So the first thing I'm going to do is flush, and so I'm just putting some normal saline, and this is to make sure that everything is patent. I'm going to push this in. I can put in 10 milliliters, I can put in 3, just as long as I can start seeing that it's flowing through. Okay, now did you feel a little cold there when I did that?
Just a little.
Okay, so now I am going to actually do your medication. I have to do this over 4 minutes, and so that is, I think it was like 2.5 milliliters a minute. So 1 minute, 2 minutes, 3 minutes, 4 minutes. Okay, that looks good. And the next thing I'm going to do is flush again. And what this does is make sure that we've got all of the medication through your port. It makes sure that nothing's stuck in there, and we will put in, we can do 3, 5, 10, depending on just as long as we make sure that everything's gone through. At this point, what I would do is make sure that at this point what I would do is make sure that the patient is comfortable, watch him a little bit, make sure that everything's going out, make sure that he has everything that he needs. While in the room, I'm going to throw away and put all of my used syringes and needles into a sharps container. I can just throw away the empty bottle, and I would remove my PPE. After that, I'm going to go wash my hands and document. I would document what I gave him, time, date, how many milligrams, how long of duration for the push, and how he tolerated the push.